Hello, I'm Dr. Sriram Ramalingam, Ophthalmologist and Medical Director, Pradnya, Nethralaya. Our hospital is specialized in cataract, glaucoma, and squint services.
Squinting of the eye is usually present since birth but may not be visible during this time because the eye development usually happens after 3 months of age. So usually squints become visible after 3 months of age. The squint may be inward deviation of the eye, which is called as an esotropia, maybe an outward deviation of the eye, which is called as an exotropia. Occasionally, one eye may be above the other or one eye may be below the other. So these are called as hypertropias or hypertropias. The cause of squint is usually muscle imbalance. Not all squint start at birth. There is a one type of squint which is called as an accommodative esotropia, where the squint is seen after the age of 2.5 to 3 years of age. And on examination, one can find that these children have a very high hypermetropia or what is called as a long sight. By just giving glasses in the form of plus power glasses, one can correct this type of a squint. If squint is present in adults or it develops in adults, it usually indicates there is a muscle paralysis or we call as a palsy. When one of the muscles of the eye get paralyzed, the person develops squint, and this squint will be associated with a double vision. So an adult onset squint is usually because of the paralysis. We don't call it paralysis, we call it palsy because usually this type of squint recovers. The most common cause of adult onset squint is diabetes. Very rarely, an adult onset squint may be because of some brain tumors which may not recover unless the brain tumor is taken care of. An adult onset squint is a serious condition which needs to be attended immediately. What is the treatment of squint in children? If it is a squint which is more than 25 to 30 prism diopters, surgery is the only modality of treatment. Surgery is very safe, very effective in children. And this surgery is not for cosmetic reason. The reason being, a child with squint do not have what is called as a 3D vision. That is, may not be able to perceive death very clearly. So any surgery or squint is to regain some amount of 3D vision in the children, and it should never be considered as a cosmetic treatment. Children who are operated as early as possible can regain back good 3D vision. If you postpone the squint, it may become difficult for the child to regain what is called a stereopsis or 3D vision. There is a myth, especially in South India, where they feel that children born with squint are lucky. I usually ask, in what way a child born with a squint is lucky? He turns introvert, he doesn't mingle with the children, he gets teased upon in school. In what way is he lucky? This used to be an old time saying that there was no good treatment for squint, so they say children born with squint is lucky. A children who is born with squint requires immediate attention so that squint can be corrected. And most of the time, eye with a squint will also have less vision or what is called as a lazy eye. This also needs to be corrected. The treatment of squint is usually surgery, and surgery has got a very good success rate, and a child can be rehabilitated very well.